like to repeat what she said. Everything should be truly for everyone.
Woo!
Powerful. Everything for everyone. Is everyone feeling all right? Is everyone feeling okay? Lovely. Excellent. I still feel like it's the morning. I think my watch should be wrong enough. Okay. So now, somebody mentioned about Article 25. That's why I said close to right. Yes. In the UN Convention on the Rights of Persons with Disabilities, yes, Article 25 talks about the right to health. Health care is a fundamental right. And a very fundamental one towards ensuring one's right to life. However, we know that millions of persons with disabilities, including deaf people, are systematically denied access to health care. The point, what I love about the disability community is that we don't wait for someone to come and open the door for us. And the barriers that persons who are deaf face in the health system are not as visible as the physical barriers. They are rather linguistic, they are systematically embedded, and deeply ingrained to the health system. What do we do when we face this kind of challenge, Emily?
Thank you, Yeti. Exactly. Because these systems fail. But when systems fail, innovation steps in. And that's where Deaf Health comes in. Founded to bridge the communication gap in healthcare, it is the first ever online health education platform for the deaf community in Iran. With video-based learning, digital interpreting services, and a fully led deaf team, it is proving that accessibility is not an afterthought. It is essential to quality healthcare.
Amazing. Everyone, coming to the Zero Conference, we have the privilege of listening more about this groundbreaking initiative from the founder, Mahsa Tahzibi, from the Deaf-Led Health Initiative. It's not about waiting others to serve the dish, rather coming with a solution to end the deprivation that the deaf community is facing by the system. Mahsa, welcome, and the floor is yours to tell us more about this fantastic innovation which made solutions come from the people who are facing the challenge. Over to you, Mahsa. Maybe you can start by teaching us how to applaud in sign language. Is that okay, Mahsa? Is that how we applaud? We learn new things every day. That's what we like about Zero. Super. Over to you.
Okay, hello everyone. My name is Mahsa Tahzibi. I'm a founder of Deaf Health Salamat Noshanava in Farsi in Iran. It's an honor to be here today at the Zero Project Conference. It truly means a lot to be here among professionals who are dedicated in making accessibility a reality for everyone. Before I begin, I would like to take a moment to describe myself. I'm wearing a black blazer and a mahogany turtleneck knitted shirt. And I'm a little bit chubby. I have a big cheek. So deaf community gave me this sign name to me. They're showing my cheek from childhood. So I tried a lot to change this, lose weight, everything, but they didn't change it. So I just have it right now with me. So I want to start by sharing a bit about deaf community in Iran. Like many other countries, we do not have official statistics on population, but based on estimates, we assume that 5% of a population in Iran are deaf and hard of hearing, which is around 5 million. Iranian Sign Language is Iranian Sign Language is primary language of deaf people in Iran. Unfortunately, we do not provide formal education on sign language in schools. And if that wasn't enough, we do not have professional sign language interpreter as well, which in important situations, deaf people struggle for communication and access to basic services, specifically in healthcare. I don't want to just mention all of the problems and issues because systematic barrier is everywhere and we have to fight every day for it to have equal access to everything. And I invite you to watch this short video. This video shows some of the real struggle that deaf people in Iran face every day, specifically in healthcare. So this child is a child of deaf family, same as me. I remember myself, my parents taking me to the doctor appointment. I was so nervous. I wasn't familiar with actually, I wasn't supposed to tell this, but I don't know, it just comes to me to tell that. Yeah, it was so much pressure. And deaf people, they always face real struggle. They always miss communication, left out of their medical conversation, misdiagnosed, incorrect in treatments, and a total, exclusion. And that's why we make Deaf House created, and it's been asked by deaf people during the COVID. We started with one goal, make healthcare accessible for everyone, for deaf people. And we just started by making health educational videos, and we simply shared it in social media. And then we expanded into online workshops and also providing interpreting services. This isn't just about providing services, it's about empowering the people to take control of their own life or of their own health decisions and their rights. What makes Deaf House different? Digital. It's digital first. We do not have a physical center in Iran. We are just based on social media and video-based learning and remote interpreting. So it doesn't matter where the person lives, even if he or she is living in a rural place, they can have access. So we teach them simple things like Google Meet, how to use Google Meet, how to use Skyroom, which is an equivalent version of Zoom in Iran for better accessibility. So we teach them how to get into the Google Meet if they stuck in somewhere, if they don't have any accessibility in terms of having interpreter. And the most important part of the Deaf House is that we have deaf people in our team. So they give ideas, they tell me what to do, they create content themselves, they provide information to deaf people because they are in contact with the other deaf community in Iran. They know what is the real problem. So this is why we do this work. More deaf individuals now understand their own right, health, their medical rights, their health, their options. And this isn't just about numbers, it's about real people gaining independence and confidence. And in the past 4 and 5 years ago, here's what we've achieved. We provided more than 5 hours of one-on-one interpreting session, and also we have more than 10,000 people who are following us on Instagram and watching our educational videos. And also we provided more than 100 different topic workshops for different age groups. But we still have big challenges. First of all, we do not have a centralized platform where deaf people can easily book interpreter at the same time as a medical professional. So booking and arranging an interpreter really takes a long time, and sometimes by the time it's set up, the deaf person just gives it up to the appointment altogether. And also they cannot have access to our videos, like sign language videos, which is in Instagram because it's been filtered by the government. And also, we are not available 24/7, so it creates serious risk for people. So what if a deaf person has an emergency at 5 a.m., and this actually happened. A deaf man woke up with a severe chest pain in the morning and in the middle of night, and he and his wife are deaf, so he had no other way to call to the emergency. So he had to drive himself to the hospital in pain just because there was no accessible way to contact them. Second, funding is a very important problem that we have, and we don't have access to international disability grants as well. Corporate sponsors don't really respond. They all worried about the numbers of deaf that we have, so to see if it's benefit for them to invest or not. And then we can't continue without funding. We need these resources to pay our interpreter, cover operational costs, and keep providing resources. And sometimes we struggle to stay active. It's not because the need isn't there, it's there. They are waiting for us, but we don't have the money to keep running it. And third, there are no legal policies to make healthcare providers make sure everything is accessible for deaf people. So if there isn't any rules, so hospitals easily refuse to provide provide sign language interpreter for them, completely leaving deaf patients unsupported and excluded. So I believe that without clear laws and enforcement, deaf individuals will continue to be excluded from healthcare. So now we are focusing on 3 things. Medical awareness campaign. We are going to educate doctors and hospitals by training them how to deal with deaf patients. Also, we are going to work on our web-based application instead of starting with a full app. And then we are looking for a partnership with disability organization to make sure that we can sustain and have a long-term impact. At the end, deaf people deserve equal access to healthcare. It's not a luxury, it's a right. And by community-led action, advocacy, and digital solution, we can make healthcare inclusive for everyone. Thank you so much.
Great. Excellent. Can we give a big round of applause for Mahsa Tahzibi from Deaf Health in Iran?
Woo! Woo!
Here comes the Gen Z, right? I can feel the energy. Emily, I thought it's already morning in the US then, right? So yeah, she is
You're right.
amazing. Super. Whew. Injustice somewhere is a threat for justice everywhere. So we cannot stop until everything is truly for everyone. What a day. I cannot believe that day one of the Zero Con is coming to an end. What a day full of thought-provoking keynotes, amazing innovative pitches, great solutions from the awardees of the Zero Project everywhere in the world.
Absolutely. I mean, today has been a roller coaster of ideas,
Yes.
energy, and also really good coffee breaks.
Amazing, yeah, I see. As a coffee producer, I was the one to evaluate the coffee break. Okay, you took it, Emily. Fantastic, super, yes. But again, this day is not gonna end. We're gonna continue celebrating it in a different format. We're gonna have a good food, a great company, and guess what? Live jazz. I love jazz. Hey, you don't look excited. Okay.
That did not sound very
Imagine,
enthusiastic.
yes.
So yes, you heard that right, because we know you can't get enough of us. So we're inviting you all to stay right here at the UN for Dinner and an Act, which is a fantastic networking dinner featuring the one and only Lurinc Barabas Quartet. The renowned Hungarian trumpet artist will set the perfect mood for jazz while we enjoy some well-earned food and conversation.
And don't put Google Map. It's just happening downstairs. But make sure that you make as many friends as possible. That's what keeps me always awakening. And everywhere I go, now next time I'm in Iran, I'm gonna call Mahsa Tahzibi. Make sure that you make new friends from new places. Enjoy the good mood and the great food. And amazing Gen Z, Emily's energy is gonna also follow you. Day one, Zero Con 2025. We're gonna continue celebrating it with an amazing food and a fantastic live jazz downstairs. See you all downstairs. I'm running to go there. See you tomorrow. Enjoy.